research that CME and Mental Health Foundation did on stigma by association in mental health nursing. If you want to introduce yourself into the chat, then feel free to do that. I'm Bryony, I'm the project officer for workplaces. I'm just doing the introduction and some housekeeping for today, and then I'll pass over to Brady, Miriam, Julia, and Wendy for the actual presentation. So thank you for joining us. And I'll go on to the next slide. So as we are talking about mental health and stigma by association, and there may be some other emotive topics that come up throughout this research, just keep yourself safe. So if at any point you're feeling particularly emotive or you just want a wee 5 minutes out of the session, then feel free to take that and then come back in if and when you feel ready. Respect that everyone has different views on mental health and mental health nursing and services and has their own personal experiences with that. So just respect how everyone's views within the session and treat how you'd like to be treated. And lastly, confidentiality. So we will have some time for questions and discussion. If you're sharing anything personal, please just don't include any identifying information for anyone else that's involved in that situation. Or if you're talking about a colleague or a service user that you've worked with, then again, just don't use identifying names when you're speaking about them. And we'll keep everything that's in this space confidential. So thank you. And that's our Safer Space Agreement. If anyone's got any objections to those housekeeping rules, feel free to just pop it into the chat or raise your hand and we can clarify things a wee bit further. And for those of you that have not heard of CME and are joining one of our anti-stigma sessions for the first time, then I'll just give a brief introduction. So CME are Scotland's national programme for tackling mental health, stigma and discrimination. And we really focus on changing behaviours and cultures and systems to ensure that people with experience of mental health problems or illness are respected, valued and empowered to achieve the outcomes that are important to them. So we're funded by Scottish Government and work very closely with MHF, which are one of our managing partners, which have led the research that's going to be discussed today. And that's my introduction. So I'll be keeping an eye on the chat, and I'm also the safeguarding lead for today. So if anything is particularly emotive and you want to pop into a separate breakout room to have a chat, I'll also be in hand for emotional support and safeguarding today as well. So if you are wanting a chat, just directly message me in the chat function there. I'm happy to pop into a breakout room to have that discussion. So yeah, that's me, and I'll pass over to Bridie, Miriam, Wendy and Julia.
Hi, I think it's me to give a very brief welcome and introduction to today's session. So it's great that we're here and an opportunity to share this really interesting research. I think for me, the background to this is that it's there's a multitude of things that have happened, I think, that guided us to why it was important to do the research. So first and foremost, in 2022, we had some research done looking at the Scottish mental illness stigma study. And that was really looking at the experiences of people who identified as living with complex and severe mental illness. And we wanted to run a national survey and study to see to what extent is mental illness, stigma and discrimination still prevalent? Is it an issue? And what's the nature and the scale and the impact of that stigma? And also what needs to be done about it. So that research really highlighted that unfortunately stigma around mental illness is still pervasive across many levels of our society. And I think what it does is it really brings into stark attention that our job around public stigma and stigma in terms of attitudes, assumptions, stereotypes around people living with mental illness are still very much in existence across society. It also highlighted the structural nature of stigma, so in a sense that it's woven in through the ways in which our policies are designed and delivered, how our organisations are run. It's influenced by cultures within organisations. It impacts on lots of people. And one of the things that came out from that research was the stigma by association. So people who are in close contact with other people who live with complex and severe mental illness there is data that really suggests that by association that stigma is still a significant factor and a real barrier to people both being included, being able to access different points of service and benefit from. So that was a piece of research that was done, but simultaneously there was work being done looking at mental health, nursing, mental health nurses, and a review underway of mental health nursing in Scotland. Alongside that, there was a lot of thought and talk being given to the numbers of mental health nurses who were starting in their training and leaving midway point in their training, or and also what's the experiences of mental health nurses when they're qualified and they're working in services. And there was a lot of anecdotal evidence that suggested that stigma was prevalent and was having an impact. And I think what the partnership that formed to take this work forward were really curious about was understanding, is stigma still an issue? In what ways? And if it is, what can we do about it? So there was a very genuine curiosity about what's the nature and the scale of stigma and what impact it might have. So the partnership really that formed was ourselves and CME, and we had fantastic relationships and support from the Mental Health Lead Nurse Group across Scotland. Mental Health Foundation led the research, and Bridie and Miriam will talk you through that in a moment. And Abertay University is our academic partner, and it was brilliant to be able to work alongside Abertay really to take this forward. And it was funded in the main through the Scottish Government mental health workforce team. So really very much with an interest to say, let's understand this more fully. And it was a commitment within the Mental Health Nursing Review. So what we'll do is we'll share the findings of the research just now, and then we can come back to talk about what we hope to be able to achieve on the back of this really important research. So, but a big thanks to all of the partners involved, and looking forward to Bridie and Miriam sharing the reflections on what was gathered. Thank you.
Thank you very much, Wendy. So good morning, everyone. I'm Bridie Rudd. I'm a research manager at the Mental Health Foundation, where I lead the research and evaluation for CME. And delighted to be here today to talk you through some of the findings, as Wendy said, from the recent research project exploring stigma by association as experienced by mental health nurses in Scotland. The research is the first phase of a multi-year project that Wendy has just described. So we're just talking through the primary research phase, which is going to inform the future aspects of the project. So just to give a bit more background to what Wendy was saying, nurses across the UK are known to have a high incidence of mental health issues. The NHS acknowledges that almost a quarter of sickness absence for nursing staff is due to anxiety, stress, depression, or other psychiatric illness. And sadly, the level of suicidality in nurses is also estimated to be around 23% higher than the national average. A survey of registered nurses in 2022 showed that more than 50% of people leaving the profession do so before they had planned to. And reasons for leaving the profession commonly related to mental health problems, lack of support from colleagues, and stigma and discrimination. Scotland is now facing a crisis in terms of mental health nursing, so a critical shortage within the field. Over the past decade, there's been a sharp UK-wide fall in the number of mental health nurses. And for the past 3 years, Scottish universities have been unable to fill the places that they have available on their mental health nursing courses. And if these trends continue, this will severely impact access to and quality of care, patient safety and treatment outcomes for people living with mental illness, and negatively impact on staff well-being and morale. So whilst a combination of factors are likely responsible for these recruitment and retention challenges, one of the factors, and the one that we've been interested in within this study, has been stigma by association. So just to give a quick description of what that means, stigma by association is when someone connected to people with a mental health problem are then stigmatized themselves. So someone, it might be a family member, a friend, who experiences stigma as a result of their association with someone living with mental illness. And in this instance, we're talking about mental health professionals who are then stigmatized because of the field of work that they've chosen to work in. International studies have identified high prevalence rates of stigma by association within mental health professionals and trainees, with impacts on mental health nurses and people accessing services as a result. However, no research has yet been published on this issue in Scotland, and there's little from across the UK. So in terms of the research, that's where we started off. And we've undertaken a key piece of research over the past couple of years to address this. So how does stigma by association impact on the mental health nursing workforce in Scotland? This has been the key question underpinning the research that we've conducted. And so we've set out to explore the nature and scale of mental health stigma and discrimination experienced by mental health nurses in Scotland, the extent to which these experiences impact on nurses, and what can be done to address it. We designed a cross-sectional mixed methods study, which comprised of an online survey and follow-up questions and interviews. The study included people who were previously or are currently either working in mental health nursing or studying mental health nursing in Scotland. Questions focused on participants' experiences of stigma and discrimination related to their profession specifically. We used the clinician-associated stigma scale to measure perceived and identified stigma amongst mental health nurses. And then we supplemented that with our own questions relating to the experiences of mental health related stigma and broader experiences of intersectional stigma. 636 people completed the survey. Roughly 2/3 of these were current mental health nurses, and approximately 1/3 were mental health nursing students. Survey respondents were invited to participate in follow-up interviews and focus groups to explore themes arising from the survey in more depth, and 14 people took part in 13 interviews and focus groups during that phase, either online or in person. So what did we find? Quantitative analysis was used to explore the descriptive aspects of the measures and differences in reported stigma based on the demographic variables and other wider stigma experiences, as well as differences between current and former professionals and students. For the qualitative analysis, focus groups and interview recordings were transcribed and anonymized before analysis. And we analyzed transcripts and open-ended survey responses separately using thematic analysis to identify common themes. Transcripts were coded and went through a manual process of refining, and then we compared the themes across data sources and identified commonalities and differences. Yes, sorry, I got to what do we find slightly early there, but let me now talk you through some of our headline findings. Firstly, experiences of stigma by association were common. 44% of respondents agreed that they had experienced stigma related to their profession whilst at work or university. Findings from the Clinician Associative Stigma Scale, or CAS, because the full name is too long to say, they supported this finding. So again, revealing that many participants experienced a notable level of stigma in their profession, even when they don't recognise it as stigma. So in fact, all but one survey respondent reported experiencing at least one of the stigmatising scenarios described in the measure, at least some of the time. And more than half, so 55%, reported facing stigma in at least half of the situations described by the questionnaire. So a notable level of stigma. And this suggests as well that approximately 10% of participants experienced a considerable level of stigma that they did not recognise or label as such. Overall, we found that current mental health nurses and students reported experiencing similarly high levels of stigma. However, current mental health nurses felt more uncomfortable telling people that they worked in the field and encountered more stereotypes about their own mental health as professionals. Students were confronted with more stereotypes about mental health nurses' professional effectiveness and reported encountering more negative stereotypes about people with mental illness. So to summarise, whilst we consistently found that around half of participants recognised having experienced stigma at work or university, a much higher proportion had stigmatizing experiences, such as being told that they don't know what they're doing or that their job is pointless. We found that as a result, almost 1 in 10 have taken time off or left a mental health nursing job. I'll pass over to Miriam now to talk through kind of what that means in terms of what people were actually saying within the qualitative findings.
Yeah, thank you, Brady. So we've heard a bit about the numbers, but I think it's really important to kind of look at what stigma actually looks and feels like for mental health nurses and nursing students. So we use the open text survey responses alongside interview and focus group data to build a picture of the stigma experienced by mental health nurses across Scotland. And the quote on the screen is from a mental health nurse who left the profession early, and it shows how the profession was just consistently undermined. So it says they would diminish the role that you did. They didn't understand the impact of mental illness on people, and there was a perception that I babysat people. That's what they thought I did. So if we're looking at the sources of stigma, stigmatizing comments often came from a range of other medical healthcare professionals, including general nurses. It also came from mental health nurses themselves and their peers, as well as nurses' friends and families, and patients and their friends and families too, and the media. So, for example, One Flew Over the Cuckoo's Nest was frequently cited by participants as an example of an extremely stigmatizing representation of mental health nurses, and it was also stigmatized by the wider public. And we have identified 5 key drivers of stigma by association in mental health nursing. So the first was a lack of public knowledge and understanding of mental health conditions and the mental health nursing profession itself. And publicly held negative attitudes and beliefs about people with mental health conditions were closely tied to many negative beliefs about the profession. For example, participants described encountering stigmatizing comments about the profession, which were based on the belief that it must be scary, because there's this kind of false assumption that mental health patients are inherently dangerous. And mental health nurses also faced significant stigma when it came to their own mental health. And this stigma comes from both the public and within the profession itself, creating this environment where seeking help is often seen as a kind of weakness rather than a necessity. Participants also described frequently hearing comments from other medical professions, often in general adult nursing, stating that mental health nursing is not real or not proper nursing. And underpinning this theme is the systemic lack of parity between mental and physical health, which was perceived by participants as resulting in less funding and fewer training and work opportunities for mental health nurses. And stigma, we know that stigma is experienced differently according to different intersecting characteristics that a person may hold. And this was particularly apparent within the research. So gender, age, race and ethnicity, and sexual orientation and maternity were mentioned as playing a role in the type of stigma that was experienced. And there were pretty shocking examples throughout the interviews and survey responses of how intersectional stigma impacted upon mental health nurses and patients. And we'll come back to this when we speak to one of our participants in 5 minutes or so. And workplace culture was the final driver that was mentioned here. So participants spoke at length about these kind of change-resistant, anti-woke, old-school practices within mental health nursing, where vulnerability and reflection and empathy were not seen as strengths. And many also described working environments where there was very little emphasis on support or supervision, and which upheld this focus on hierarchy and top-down power structures, making it very difficult to challenge stigma or to speak openly about challenges once they arose. Participants also spoke of these kind of conflicting and paradoxical attitudes around mental health nursing, and it was commonly perceived as scary, whilst also being minimized as easy on the flip side. And this is just one of the many quotes which describe this. So it says, "I have been told that myself and all other mental health nurses just sit around drinking cups of tea and colour in. I have also been told that mental health nurses are not proper nurses and that we do not help save lives. It is an easy yet boring profession, and I would be better becoming an adult general nurse because there are more skills to learn for treating patients." So that just kind of gives you a bit of an insight into the kind of way that mental health nursing is kind of repeatedly minimized by others. So it's clear that stigma related to the profession can lead to a wide range of negative outcomes for mental health nurses and patients. These include increased stress and anxiety, feelings of isolation, that feeling of being really undervalued and demotivated within the profession, feelings of frustration and irritation, and negative impacts on people's identity or self-esteem, and in the kind of more extreme end of the spectrum, experiences of trauma and feeling unsafe and unsupported within work. It's also worth noting, interestingly, that there were a few positive impacts of stigma that were brought up by participants. These included feeling more motivated and more driven by stigma to make a difference within mental health nursing, and being more committed to raising the profile of mental health nursing. And a couple of quotes on this slide go into the kind of attitudes around the kind of difficult decisions that mental health nurses have to make on a daily basis. So around physical restraint and the impacts that that has on their self-esteem within the profession. So the consequences of stigma associated with mental health nursing can be huge. So burnout and compassion fatigue impacts upon both mental health nurses and their patients through changes to their ability to form positive relationships and embody healthy working practices. So for students, stigma and discrimination resulted in fewer and lower quality learning opportunities. And students we spoke to recalled hearing on placements attitudes like, "You won't need to know this, you're just doing mental health." And as we've seen in previous studies, such as the Scottish Mental Illness Stigma Survey, in many cases, experiences of stigma can lead to withdrawal. So this may include avoiding discussions about their work with friends and family, or this reluctance to share their professional experiences, which can further exacerbate feelings of isolation and a lack of support. And for those struggling with their mental health, that can be a really vicious cycle, as many of the nurses we spoke to spoke of feeling the need to hide their mental health challenges from those around them. And for others we talked to, withdrawal meant withdrawing from opportunities at work, taking a career break, changing roles, or leaving mental health nursing and changing careers altogether, further exacerbating this recruitment and retention crisis within mental health nursing. And now we are going to hear from a mental health nursing student themselves to talk about their reflections on this research and how their own experiences align with the findings from this research. So we are going to hear from Juliet Madarakiri, who is a second-year mental health nursing student at Robert Gordon University. I'm delighted that Juliet is able to come and share her experiences with us today. Juliet, are you on the call and are you able to take yourself off mute and share your camera?
Hello?
Hello, Juliet. It's so lovely to hear from you.
Hello. I don't know how to do the camera.
Oh, don't
Lord
worry.
have
Look,
mercy.
you don't
Oh,
have
okay.
to share if you don't want to, or if you're not
Uh,
able to. Um,
I think allow.
oh, great. Lovely to
Yeah,
hear.
okay.
Lovely to see you, Juliet.
Hi, everybody.
So we've just got a couple of questions for you, Julia. Just first of all, thank you so much for coming on today. But firstly, could you tell us a bit about your experiences of mental health nursing and how they align with the findings from this research?
My experiences have been quite varied, but they do definitely align closely with the research findings, such as the 55% who reported facing stigma in at least half of the measured situations. I've encountered frequent stigmatizing attitudes. The finding about people being told their work must be scary or that they don't know what they're doing resonates with my own experiences because on my second placement when I was the first year, I was at ARI, which is a general nursing ward, and um, we were having a conversation about assignments. And this person turned up when we were having the conversation, joined the conversation, and then they were like, "Oh, you need to do things this way, blah blah blah." And I said, "Oh no, I'm not doing that assignment. I'm doing this." She's like, "Oh, why?" And I was like, "Because I'm doing mental health nursing." The, the person started laughing. They were like, "Wow, okay, you chose the easy life, right? You chose the easy life." So that was quite. I was actually a little bit annoyed and shocked, and I was thinking, "Wow, you know, we are in 2025 and we're still treating mental health this way." So that was really quite sad. And also being a black person, I have experienced racism, and I know a lot of people that have experienced racism as well. But it's just that people are scared to really talk. Like in particular, there's been quite talk since our second placement that um, most of the Black international students, they've actually swapped to adult nursing because they have been advised by previous students that it is in their best interest as Black international students to do adult nursing. So that was quite shocking and quite sad because these are people that chose to come um, and train as mental health nurses. And I think it was, I don't know if it was Breeder, somebody touched up on the fact that there's not enough students signing up for mental health nursing. I can't remember who it was that was talking. So it really kind of resonates together that there is a reason for that. Is that people are choosing to do mental adult nursing rather than mental health nursing, whereas mental health nursing is needed as well as adult nursing, children, and all of that. So yeah.
Yeah, thank you, Julia. It's so frustrating to hear that, and especially that kind of intersectional aspect of it. You know, if Black mental health nurses are repeatedly being told to switch into general nursing, it's really disappointing to hear about, and it just hammers home how important kind of some action on this is. Um, can I ask if there's anything that you were surprised about by the research?
I think probably the 9% of people have taken time off or left mental health nursing because of a stigma. That was quite striking. That to see that there is quite a lot of people experiencing negative behaviors, whether at work or as a student nurse. So that was really quite sad, and it makes me quite happy to know that we're you guys are doing this because you're putting it out in the open. And I am probably the most annoying person on earth in terms of trying to talk about racism because I don't think that it should be ignored, and I think we need to have those uncomfortable conversations so that people are aware, because sometimes it is just ignorance that makes people behave a certain way, including the mental health illnesses. So if we don't have the conversation, people are not going to learn. So I am really happy to be a part of this.
Absolutely. Thank you so much, Juliet. It's so important to have these conversations, whether, they're uncomfortable, but it's so important so that we can have the full information that we need so that we can start addressing stigma within the profession. And what would you like to see happen as a result of this research?
I think just recognition. I think recognition is really important for mental health because it is important. Um, and for it not to be at the back burner all the time. It needs to be recognized just that it's just as important as adult nursing, as children's nursing, because people are suffering, and we're finding more and more that there's a lot of people that are suffering from mental health, whether it's patients or healthcare professionals or anybody for that matter. So I think, like I say, that sounds like a broken record, but I can see that with this study that you guys have done, you're pushing mental health stigma forward for people to recognize that, this is happening and we need to tackle it, whether it be for a patient or whether it be for our work colleagues or our fellow students, it needs to be tackled.
Absolutely. Yeah. Thank you so much, Juliet. It's as you said, mental health nursing is such a valuable and important profession. And stigma is this mechanism which consistently undermines the profession, and we need to stop that from happening because we've got a recruitment and retention crisis in mental health nursing, and they are such a valuable role in healthcare for people with mental health challenges and problems. So yeah, it's good to hear your insights and experiences. We're just going to go back into the recommendations from our research that we made. So Bridie, are you able to just come back onto the next slide? Brilliant, thank you so much. So the report concluded that stigma by association significantly impacts the mental health nursing workforce in Scotland. As we know, the stigma leads to job dissatisfaction, low resilience, professional burnout, and a desire amongst current staff to work in other sectors of health. And ultimately, it affects the recruitment and retention of mental health nurses and contributes to the critical shortage of mental health nurses in Scotland that we're currently seeing. So based on participant suggestions, this report makes a series of recommendations. So firstly, participants called for better resourcing of mental health nursing and suggested actions to help the profession become more visible and more widely celebrated. So people also felt that the public need more information and education about mental health in general, alongside the role that mental health nurses play in recovery. Interview participants also called for more mental health education within general nursing and broader medical professions, and the balance between training clinical skills and mental health specific skills was also highlighted as an area for improvement, particularly by current students from universities at which mental health nursing is not offered from day one on the course. And finally, workplace culture, particularly leadership, was felt to be particularly important in supporting mental health nurses and students to challenge stigma and to thrive in their roles. So positive reinforcement and support for managers, as well as faith in robust reporting processes, are crucial in creating an enabling environment where staff feel safe to report stigma and discrimination as they encounter it. So next we've got a wee video clip where Keith Russell, who's a nurse director in the Mental Health Nursing Leads group, talks about his reflections about how stigma is experienced by colleagues, and how this research might help to better recognise stigma and how that can be the first step in addressing it.
I think we are in the early stages of the research. Stigma by association in mental health nursing has been around for quite a long time. Interestingly, when I started to speak to colleagues in Tayside about stigma by association and the opportunity to be part of the research, nursing colleagues couldn't really connect with the idea of stigma by association and having experienced stigma in their own careers. But through conversation and discussion, it was quickly evident that many of us had experienced different forms of stigma by association during our working careers, and it was an opportunity for us to think critically about what that means, not only for us as registrants, but also for our student nurses who we're working together with to prepare for future practice. And frankly, some of the experiences that have been articulated in the report just aren't good enough. And they need to change and improve so that student nurses from a very early stage feel the value and the benefit of being a mental health nurse. I've been a mental health nurse for over 30 years, and it's been a wonderful career and a wonderful profession. And I think as nurse leaders, we have a duty to progress the profession in Scotland, challenge the issues that we see, and work together to address them. So I'm very hopeful and very optimistic that our recommendations around education, policy and resources and cultural workplace changes will make a positive impact for mental health nursing in Scotland. And I really hope that we can continue to work on the project together and think about the subsequent phases and how we work together to design and test approaches and methods that might make a significant change and improve the experience of mental health nurses and students, and ultimately the people that we care for, because that's the key thing. We have to be equipped with the knowledge, the skills, but also work in a culture and an environment that enables us to flourish and reach our maximum potential, so that we can deliver truly person-centred, safe and effective care for patients. I think we are in.
Yeah. So unfortunately, Keith wasn't able to make it along today, but it's really useful to hear his insights in these video clips. We've just got another one just next, where Keith talks about the key takeaways from for tackling stigma by association in mental health nursing.
Firstly, I think to surface this issue is really positive. It's something that some of us who have been around nursing longer than others recognise, and to surface it, to bring it out into the open and have a discussion about it, I think is a really important thing. I'm particularly troubled by the experiences that undergraduate nurses have during their training, and at the outset of careers we need to be really challenging stigma by association, and I think just having a discussion where we're thinking more broadly about stigma, thinking more broadly about the impact that it has on people, on the job that they do, on the career choices that they make, and their longevity in the roles that they do, at a time when there's a critical shortage of mental health nursing in Scotland. It's hugely valuable, hugely important, and I hope that we will see significant change as a consequence of the research.
So thank you so much for listening. We've got some time for questions later on in the session, so please do add any questions into the chat. I think that there have been a few already, a few comments. But yeah, so next we are going to hear a bit from Wendy about the next steps from the research. So passing over to Wendy.
Yeah, thank you so much. I think Keith summarised actually much of what we've been thinking about. The main thing is about sharing this information, this data that's collected, as far and as widely as possible. So there's an engagement plan, an engagement strategy in place, looking to see how can we take this to the different nurse directors, the nurse leaders, to really think through what this data tells us and what the implications are and what opportunities there might be to look at taking anti-stigma work forward in and through mental health nursing as in terms of profession, in respect of how do we look at it as a workplace issue, how do we support nurses when they're in different placements in different settings, And that's both for mental health nurses specifically, but it's also for adult nursing more generally. So I think what we're recognising is that there's a kind of awareness raising exercise that's needed across the range of disciplines to really unpack this, to look at what it means and how we can really address it and what actions can be taken. The other thing I think that's really important, and Keith said, was about undergraduate experiences. And there's something really fundamental about that. So, how do we change both the undergraduate teaching experiences in a way that really highlights stigma and the nature of it and what can be done about it? Also, to almost equip people to be able to challenge stigma in a way that's not confrontational, but actually raises awareness. And how do we build capacity and confidence in the range of both students and professionals working as nurses in the system to be able to do that in a way that really exposes the stigma as it's happening, but also looks to see how do we make sure that that's not going to be the case moving forward. So really, so I guess it's about, for me, there's something about the raising awareness, the education, and the other point would be about, I think what the research report highlights is a need for almost campaigning, sharing awareness of this at 3 levels. So one would be at public level, so to bring more attention and raise more attention about this as a stigma by association as an issue, to look at how we address it within the different population professional groups. And one thing, I was speaking to somebody just today, and they're a psychiatrist, and they were saying it's not unique to mental health nursing. It's common across a range of disciplines that are worked with and associated where they're working with people with mental health problems and illness. So it seems to be a recurring issue for across different disciplines and professions. So we should be exploring that more fully. And I guess the other thing is about the undergraduate and how we campaign and how we raise awareness in respect of the issue, but also what are the realistic interventions, the activities that we can take forward in partnership. I think the one thing I would say is that CME can raise awareness of this. We can certainly look at it as part of our workplace planning. We can certainly look at part of it as our undergraduate training and also our approach that we have in health and social care. But I think what this highlights is it's a much bigger agenda. It's about collaboration. Who is it that we need to work with in a way that can really expose the issue, understand it more fully, and take action to address it? So I think what's needed in the next year is that collaboration, that drawing up a plan for what actions we can take and really tracking to see what difference it's making as a result of the activity that we take forward. So really looking forward to a collaboration, not just with the partners that were involved in this research, but more broadly, partners that have got a real interest and an opportunity to really make a difference. So a big thank you. But thanks to you and the research team for sharing the experiences and learning so far. Thank you.
Thanks, Wendy. Yeah, it's really good to hear about the next steps, and yeah, I just echo all of that. It's it should be on everyone's agenda to tackle stigma within the profession, and mental health nurses, they change lives. It's such an important, valuable profession, and they change lives not just for their patients, but I'm sure they'll kind of employ the same skills in every aspect of their lives. So it really is crucial that we raise the profile of the profession.
Yeah.
I think that we have had a few comments in the chat. I've just been having a wee look. Sarah, have there been any questions yet?
No questions, but Keely has said that she would love tools which equip her how to challenge in a non-confrontational way that could share with colleagues. It's something that is not taught at university, and she's challenged a lot in practice, and it's always ended badly for me. Is that the sort of thing that we could look at as part of the follow-up to this?
Yeah, definitely. So Rachel, one of our officers who's doing some amazing work in health and social care and undergraduates, is looking at this just now, Keely. So it's definitely something look forward to in the future about what tools and resources might be available for you to be able to engage with, but also inform and then to take forward.
And yeah, I can appreciate how it's that kind of challenging this kind of stigmatizing attitude, but not kind of coming across as really confrontational, because quite often it's coming from people that you're having to work with for every shift. So it's a tricky balance, isn't it? But yeah, if Rachel is working on some tools to combat that, that's amazing.
There's Rachel popped her email in the chat, so that's great. Yeah, I think it's something that it came up in this research, obviously, is something that's required, but it's something more generally that people are really seeking about. How do you challenge? What are the tools and resources that you can have to hand that allow you to challenge stigma as it's happening in that situation in a way that safeguards you, but also raises awareness and really challenges, the attitudes, the behaviours and assumptions, and at times prejudice that's around. Yeah, Karen. I think, Karen, your point there's about, 13 years of a nurse and things haven't changed. And I think that's what Keith shared, isn't it, in his video there about it's a long-standing issue. So we really need to be getting much more in and about it in this year and really addressing it as an issue that's impacting on not just nurses and students, but the patients, the people who are, it's really important that the nurses and students are there to serve. So I think what this research really helpfully does is draws attention to that, those experiences again, and reinforces the need for further action.
Yes, and as an example of that, Abertay University, who have been a partner on this research, their mental health nursing department, Tabith Timber Emmanuel, has been working with us to conduct the research, but she's been able to take the findings of the research and look immediately at what can be done on the mental health nursing program at Abertay to start to address that and really embed within the program some tools for students to support them on placements, to give them better tools to support them when they're going out and about within their work and their education. So we've been able to see immediately what can be achieved through the findings of this research, and we really hope that we can work across Scotland with universities and the NHS and other partners to continue that. Now, I know we've had a few other comments and things in the chat. I think most things have been addressed as we've kind of gone along, but if anyone does want to either pop anything else in the chat, I'm sorry, I'm being blinded here, I can't see anything. We do still have another couple of minutes.
I think that's an interesting point about, nurses. There's a point here that mental health nurses that are guilty of self-deprecating comments before someone else has had an opportunity to make them. And that's quite a common thing that we see, is people almost kind of raising awareness of the stigma and discrimination, and just that self stigma and that feeding into your own experiences, and I think that's why really looking at it both as an undergraduate but also a continuous professional development is really important about how do we almost stop that cycle where it's the self-stigma that's really feeding in and fueling some of this, as much as the stigma that you experience from other colleagues in the different environments.
And yeah, I would add that we heard that actually quite a bit from the participants we spoke to, that they quite often in the course of the interview they would acknowledge that, and it was kind of realizing then and there that they were guilty of making these comments themselves, that kind of undermine the profession. And it was almost like a defense mechanism. So it's completely understandable if if they're saying, oh well, I just have a chat with patients, that sort of thing. So that you can kind of defend against any attitudes as and when they arise from other people. But yeah, it's recognizing that mechanism is leading to further stigma around the profession, and stopping the cycle in its tracks, essentially.
Yeah. And I guess there's another point just popped up in the chat there about, do we think that further training should be an ongoing for adult nurses specifically? And I would say yes, definitely there's a need for that. And we're hoping that this data, we can use it really to leverage further investment in continuous professional development around mental health, mental illness, stigma and discrimination more generally, but specifically as a workplace issue and as it exists within both healthcare services generally, but also mental health care, including mental health services. So for sure. And we've been campaigning really or requesting that there's much more national investment in training and learning and development opportunities and really opportunities for some of that personal reflection and really critical thinking about reflective practitioners. Really, how do we make sure that we are looking at creating and contributing to a non-stigmatising or anti-stigma approach in all of the services, and ultimately that's what we're really pushing for.
And just seeing your comment in the comments there, Keely, as well about an adult nursing placement within mental health nursing. And yes, completely agree, that would be an excellent idea. I'm really glad to hear that that's happening. We know that across work to tackle stigma and discrimination, that one of the most important things that can be done is social contact. So actually making sure that people are getting to meet people who dispel their false beliefs and so prejudice around people with living with mental illness. So that is crucial, and in this case it would also be dispelling the myths around mental health nursing if you're actually going and working on a ward. So I think that would be a really key thing that could be done.
Yeah. And I think, there is some good examples of where through either integrated practice or multidisciplinary working that some of the barriers are beginning to get broken down. So I think, the more that we can encourage that, the better, really, that kind of sharing across disciplines and bringing lived experience much more fully. Just this morning, I was at a session with Stigma Free Lanarkshire. It's a local area partnership. And they had a recovery event recently, and that was fantastic because it brought together people who live with mental illness themselves, but alongside a range of different professional groups, including mental health service staff. But we were just saying it's such a good opportunity to build on that and develop it further. So it's breaking down some of these myths, misunderstandings, stereotypes that are often over prevalent, I think, in and across the different services and across and within different professional groups. So there's just one example that came up today of, really trying to break down through bringing that lived experience, bringing those examples really to the fore. Rachel, you've popped up.
Hello. I just wanted to say that this has been so interesting and obviously loving this piece of research, but also just to flag, like I said in the chat, the work that we are doing within universities. We're delivering training for mental health nursing students around stigma, and in particular different marginalised experiences of mental health stigma. And we're also starting to do more work now with general nursing. And so that we're definitely opening up and doing that cross-discipline work to try and get everybody's awareness and understanding to a better level. but also we have been developing some bystander intervention pieces which are exploring for what are the barriers for students. So we recognise that if it's not safe to challenge and report, then the stigma will continue, and mental health nursing students and nurses will be surrounded by these cultures that aren't safe to speak out within. So the thought of going in and delivering a kind of tandem training in the cultures where we can make sure that they're fit for our nurses coming in would be amazing work to do. So really looking forward to seeing how this all develops, and hopefully I'll get to be a part of it. Thanks.
Definitely, and we've got a live example of that in the chat again, with Lynn saying that her daughter is currently just starting out at university, and her placements are due to start in March. So I hope, Lynn, that this has given you a little bit of hope for what your daughter is going to experience on her university course, and perhaps you can use the report as kind of guiding material, and just validation that actually, you know, her experiences, I hope she doesn't have stigmatizing experiences, but if she does, then she is not alone, and there are some clear recommendations that could be taken forward by the university. And yes, some other excellent examples there in the chat of the impact that your work is having, Rachel. Someone, Keely, saying that she saw one of your stigma sessions at a university and loved it. So thank you very much, everyone who's contributed to the chat today. Some really excellent examples of why this research is needed, why the work is needed, and the impact it is already having. So thank you everyone for coming along today. Bryony, I don't know if we were passing back over to you to close.
Well, I just wanted to say thank you so much to everyone for coming along today. And Sarah will be following up with the recording and details from today's session and an evaluation link as well. So once you receive that email, if you could fill it out, that'd be hugely appreciated. But thank you so much for attending today's session. And if you've not got any more questions, then you're free to go and enjoy the rest of your days. But thank you for coming along.
Thank you. Lovely to meet you. Thanks.
Thank you,
Bye.
everyone. Thank you.